Oral questions by members.
Leader of the Official Opposition.
Day after day, British Columbians, including every member of this Assembly, feel heartbroken when we hear about transmission, about outbreaks, and ultimately about deaths in our long-term care homes. The images of families being separated from the seniors that they love and the fear of losing that loved one should compel all of us to do absolutely everything possible to lower transmission rates and protect our most vulnerable citizens. Yesterday, the government announced the limited use of rapid tests in a small number of long-term care homes in 2 health authorities. My question is a straightforward one to the Premier. Rapid tests would provide an additional level of protection for vulnerable seniors. Knowing that, will the Premier immediately commit to the implementation of a rapid testing program in long-term care homes across the entire province?
Minister of Health.
Thank you very much to the Leader of the Opposition for her question. She'll know that outbreaks in long-term care, the situation in long-term care affects everyone in the province, from Rotary Manor in her hometown to 3 Links in my constituency. And I think it's fair to say that every day, everybody in the healthcare system, including Dr. Bonnie Henry and all of us, are working and doing everything we can to both assist people in long-term care and to stop outbreaks in long-term care. It's for that reason that a number of measures have taken place in BC that have not taken place in other places in the country, and we've had relative success compared to other jurisdictions in dealing with it. But I don't think people are that concerned with what happens in other jurisdictions. They want us to do everything we can here, and we are. The fact is that rapid testing, as Dr. Henry has explained many times, the rapid tests that have been sent to us are not successful or effective in dealing with asymptomatic testing, and in any event, haven't been sent to us in the numbers available to put in place such a system. It would not be effective. That said, as with everything else, we are trying absolutely everything, including a pilot project to see in what ways they could be effective in our province. Rapid testing is also being used and being piloted in other areas where vulnerable people live, from the downtown east side to rural communities. And I just want to assure her that the reason why we're pursuing the pilot is that we're pursuing absolutely every option to keep people protected. The reality is that these particular tests will not do what the honourable member is asking us to do. And if they were able to do that, there would be no reason not to do them. We're following the evidence, we're following the science, and we're doing absolutely everything we can to protect everyone in long-term care. I appreciate the member's concern and the seriousness of her question, and we will continue, I hope, to work together to provide safe solutions as possible for everyone living in long-term care.
Leader of the Official Opposition on first supplemental.
Thank you very much, Honourable Speaker. And I certainly want to let the Minister of Health know that the members of the opposition absolutely appreciate the exceptional and outstanding work being done by healthcare workers and those particularly in long-term care across British Columbia. The Health Minister himself has just pointed out how important it is that we do absolutely everything possible. So for weeks now, families, seniors organizations, and even the BC Seniors Advocate has been calling for additional action from this government. In her recent comments, the Seniors Advocate had this to say about rapid testing, and I quote, "We're going to catch some of those people. Maybe not all of them, but some of them. We have nothing right now. The question is, what is the harm in using them?" End quote. I am sure that the Premier would agree with me that we must make every single effort possible to protect our most vulnerable seniors. The Premier has the opportunity today to take additional action and implement a province-wide rapid testing program that has the potential to make a difference in long-term care homes right across British Columbia. Will the Premier commit to doing that today?
Minister of Health.
Well, thank you again to the member for her question. As noted, and it has been a disappointment to us over the terms of the pandemic, that the technology involved in rapid testing has not been as effective as we would have hoped by this point. The fact is that these tests are not licensed for what's called asymptomatic testing. So that is not an appropriate means, and in any event, that isn't an effective method. And the people who say that are the people who are expert in this area. I am with the seniors advocate, and I am with everyone in this province that wants to do everything they can. But the people who know testing have drawn this conclusion because they too care about people in long-term care, and their first principle of action is to do no harm. The member will know that this week, we will be presenting our rollout plan for vaccines in British Columbia, and she will know that the priority of long-term care, I'm not letting anything out of the bag early in this regard, the priority of long-term care workers and residents, and that vaccine plan will be key to managing the pandemic for long-term care in the coming weeks, and I mean immediate weeks. And we are going full effort on that, just as we are in ensuring and finding ways to use rapid tests in the most effective way to save lives of people across British Columbia. There is no issue more important to me personally, and I know to the member, who's also the critic for seniors for the opposition, the leader of the opposition, and that's why we're going to continue to follow the science, to follow the advice we receive from our leaders in terms of testing in the province, and make all the decisions necessary to protect our seniors.
Leader of the Official Opposition, second supplemental.
Well, thank you very much. And as we continue to battle COVID-19, every day matters, and every action matters. No one is suggesting that the implementation of a rapid testing program will guarantee the end of transmission or outbreaks, nor is the suggestion that we would replace the existing testing regime, but it would add an additional layer of protection. And in fact, to the point that the health minister made, just yesterday, his government announced the fact that they are going to use rapid testing in a small number of long-term care homes. Our question is, what is the harm in looking at a province-wide rapid testing program if it even adds a simple extra layer of protection for vulnerable seniors? The time for that action is now. If implementing a province-wide rapid testing program has the potential to provide any additional protection for our most vulnerable British Columbians, there should be no hesitation in putting a province-wide program in place. Families are frightened. Seniors are vulnerable. Will the Premier take the action that they deserve and immediately implement a province-wide rapid testing program, not just in a few long-term care homes? As the seniors advocate said, what is the harm in putting a rapid testing program in place? So to the Premier, will he make a commitment today to expand the rapid testing program to long-term care homes across British Columbia?
Minister of Health.
Honourable Speaker, we have been using rapid tests in appropriate circumstances, and that action is guided by the leading experts in public health that we have. With great respect to the seniors advocate, who the leader of the opposition cites as evidence, this is not her area of expertise. The fact is that the rapid tests are not licensed even for asymptomatic people, and that we have a better overall plan to address symptomatic people in long-term care. The purpose of the pilot project, the reason that we're pursuing even that option is to see under what circumstances you could use rapid testing to help, not to hinder, but to help our overall protection of long-term care. That's why we're proceeding with them, because every day we look at every possible option to assist people in long-term care and to deal with outbreaks in long-term care, which right now in active long-term care outbreaks in BC involve a total of 1,401 people. Regularly, I talk to the families of those people, as the member will know. I hear their concerns, their worries, the fact of their separation. And so we are taking the steps necessary. But those steps have to be effective and they have to follow the science. And that's why I'm following, in this case, the advice of Dr. Henry, the advice of the BC Centre for Disease Control, the advice of those who know these areas of testing and have worked on them all their lives to guide our policies, and will continue to do so.
Member for Kelowna Mission.
Thank you, Mr. Speaker. Honourable Speaker, the Minister has referenced science. We know from science that rapid tests can break stubborn bottlenecks. They can contain infection. They can sever the chain of transmission. They can reduce morbidity and mortality and diminish debilitating economic costs. These tests, which can deliver results in minutes rather than days. Other jurisdictions, such as Ontario, have called these a game changer. 2 weeks ago, the federal government gave BC 131 rapid test machines, 27,000 test kits, and 500,000 antibody tests. Can the Premier confirm that BC has these tests and tell us how many have been deployed in long-term care facilities? Thank you.
Minister of Health.
Thank you very much, Honourable Speaker. We've received 131 of the machines with respect to the Avid ID Now tests, and with about 27,000 tests. One might understand in the case of those machines that 27,000 tests would only be able to do the tests being suggested by the Honourable Member one time or less than one time per long-term care resident, and less than one time per worker in long-term care. Equally, they're not licensed, as we've said, for asymptomatic testing. Dr. Bonnie Henry has given the response on this question multiple times, as the member will know, that her response is founded on the science in this area. What British Columbia is doing in terms of piloting with respect to rapid testing is not dissimilar to what they're doing in Ontario. And we're going to continue to act, including ensuring that early access to vaccine, especially for long-term care workers, to hopefully ring-fence long-term care, will be a key part of our vaccine plan. But for the member, I think the member is incorrect in suggesting that those tests, or the 500,000 Panbio antigen tests, are the answer in long-term care. They are being used in British Columbia, and we're taking the very steps required to ensure that the best use is made of them, so that people in long-term care and in other vulnerable circumstances, such as rural communities, such as vulnerable communities, such as the Downtown East Side, that they can be effective. So we're following the science, we're following the advice of the people in epidemiology who lead this effort, the specific effort of testing, and we're going to continue to do so.
Member for Kelowna Mission on supplemental.
Thank you, Mr. Speaker. I can appreciate the Minister's comments, but there are still many voices calling for a widespread rapid testing program to reduce the number and extent of the current outbreaks in long-term care and to protect one of our most vulnerable populations. That includes families like Leslie Telford's, whose mom Sandy is in long-term care. She says, and I quote, "I do believe that we can do more testing. We have to pay more attention to their quality of life. We can't just lock people away indefinitely," end quote. Again to the Premier, how many rapid tests does BC have today? And how quickly could they be deployed to our long-term care facilities?
Minister of Health.
Well, I believe I just answered that question. I'm happy to answer it again. We have 27,000 tests of the Avid ID Now system and 131 of the machines. We've received approximately a little under 500,000 of the Pambio antigen tests. All of them, of course, require a nasopharyngeal swab. All of them require a healthcare worker to do the swab. And all of them are not licensed for use, except in people who are symptomatic. And even in the case of people who are symptomatic, they are not as able to pick up the virus as the regular NAT tests that we do on an ongoing basis in BC. I absolutely agree with the member that, and people frequently want this, they would like there to be a magic solution or a single solution or an easy solution. There is not an easy solution to this worldwide pandemic. We have to do the work. We have to trust in the epidemiologists who have led us so extraordinarily well in this area. We absolutely have to do testing on a systematic basis, and we have significantly increased our capacity to do testing in BC. We have to ensure, as we have done in BC, our single site model for staffing, ensure that we're adding healthcare workers, more than 1,000 of the 7,000 already hired, as proposed by the Premier in September. We have to ensure that infection control procedures are in place, and that effort's being made by healthcare workers everywhere in the province. I am with the honourable member. I am with the families in this area. In fact, I am one of the families in this area, and I can tell the member that we are doing absolutely everything we can. But wishing doesn't make it. We have to follow the advice, the best advice of people such as Dr. Bonnie Henry, and will continue to do so.
Leader of the third party.
Thank you, Honourable Speaker. And I just want to say that I'm glad that we have the opportunity to be asking questions of government after this time, and being in the depths of the second wave of COVID-19. The public has a lot of questions, and it's important we have this opportunity to be able to ask them. And as we come to terms of being in the depths of this second wave, we must recognize that COVID-19 has not only exposed the inequalities in our society, but continues to deepen those inequalities. We're not actually all in it together. Some of us have the certainty of jobs that are not at risk because of COVID-19 and can work safely from home, even relying on delivery of groceries as a buffer from the risk. Others work in jobs that don't allow them that security. Healthcare workers, teachers, principals, custodial and cleaning staff, people working in retail, food service, transportation. None of them are able to stay home while continuing to earn a salary. We also know that this virus has disproportionate race-based impacts, but we don't know exactly to what extent. My question through you, Honourable Speaker, is to the Premier. Telling people to stay home is not good enough. We need targeted supports that match the realities that different British Columbians face. To create those supports, we need disaggregated data about who is getting sick and where, including income and ethnicity. When will the Premier make this a priority and make the call to start collecting this critical data?
Minister of Health.
Thank you, and thank you to the member for her question and her assistance and advice during the many months of the pandemic. The member will know that British Columbia was the first to provide information around modeling, the first to do a province-wide survey to see the effects of COVID-19 on groups across BC. That all of that information is publicly available, and we've continued to do so. It is the case that right now we are not providing, daily case counts, disaggregated data, but we know what the facts are. We know precisely what the facts are with respect to Indigenous people. And we know that people who are doing essential work and others who are vulnerable are most affected from COVID-19. I agree with the member that COVID-19 affects people differently. It clearly does. We only have to look at long-term care. We only have to look at people with chronic diseases. We only have to look at people who are doing essential work to know that. But I disagree to say we're not all in this together. I think people in BC have come together in extraordinary ways, and we have to continue to do so. We will continue to add and provide information and more information to people. But we have a pretty strong idea, and that's why the host of measures taken by the government across government ministries have supported people who are renting, supported people on income assistance and disability, supported people in vulnerable circumstances, raised up the wages of workers in long-term care and so on. We understand the scope of the situation, and everyone understands that the impact on some is greater than the impact on others. But I believe we can best respond by coming together as a province. I know the member agrees with that, and I know we'll continue to do that.
Leader of Third Party on supplemental.
Thank you, Honourable Speaker, and I agree absolutely with the Minister of Health that British Columbians have indeed come together in the face of COVID-19. But that doesn't mean that it is impacting us equally, and I heard him agree with that as well. It is government's job to put policies in place that recognize that the impacts are not being felt equally and respond to that inequality of impact. And to do that, government needs evidence and data. We need to heed the voices of countless community leaders who are calling for this change and to collect disaggregated data from Black and Indigenous community leaders to the Human Rights Commissioner to the South Asian Mental Health Alliance. Visible minority communities have been hit harder by COVID-19 than the general population across the country, but in BC we know very little about what is actually going on. We are one of the least transparent provinces in Canada when it comes to COVID-19. Most other provinces are far ahead of us in providing more detailed information about where cases are occurring and who is affected. And yet this doesn't seem to be a priority. My question again through you, Honourable Speaker, is to the Premier. Why isn't BC heeding the calls of the leaders of communities who are asking that we collect more disaggregated data and be less transparent in our explanations about COVID-19 and its impacts?
Minister of Health.
Well, I simply disagree, and I do so respectfully with respect to the collection of data. What BC is doing, that many other jurisdictions in the country are not doing, is continuing to do case management and systematic contact tracing, which means we're treating cases of people not just as groups, but as individuals. We've hired, for example, over 1,100 contact tracers since August, in addition to the team of contract workers, contact tracers, more than 500 that we put in place before. So I think British Columbia and the British Columbia Health System has a greater understanding of the impact of COVID-19 on communities and how to address it. And that understanding informs our decisions. I simply disagree with the member that we aren't being transparent. Well, I think one important consideration I put to the honourable member, because sometimes people did, and this was true at the beginning of the pandemic, and it's true now. There is a desire for more information about where COVID-19 is in communities, but it's also critical for us, including for all of the people most affected by COVID-19, including the very people that the member talks about, that privacy be maintained, that people be protected, that they trust their healthcare system, that they can come forward so we can contact trace. Those are critical values that we've put in place and have balanced here. We were the first to provide our modeling. We provide regular detailed information, respond to questions virtually every single day, either in press conferences or in other forums, and we are in the legislature. And I'm always looking to do better. And clearly on the case of taking disaggregated data, disaggregated race-based data, we have a direction from the Premier and the government to do better, and we will. But at the moment, the effort we're making in British Columbia, the extraordinary effort of our whole system and our whole province, is second to none in Canada, and we must continue to make that effort together, because this pandemic isn't going away anytime soon, although there is some good news on the horizon, and we got a lot of work to do together.
Thank you. Thank you, Minister. Member for Surrey White Rock.
Thank you, Mr. Speaker. This pandemic is having a profound effect on the mental health of British Columbians. For many, the increase in social isolation and uncertainty is leading to the increased levels of distress, worry, and anxiety. There is a critical need for more mental health services than what is available today, and unfortunately, the need is only going to get worse in the coming months. My question is to the Premier. Where are people struggling with their mental health supposed to go for help today?
Minister responsible for mental health and addictions.
Thank you, Mr. Speaker, and may I first congratulate you on your historic election. It's a proud moment for British Columbia. I thank the member so much for his first intervention in the House and for his first opportunity to speak to talk about this double whammy of the pandemic. We know how much people in British Columbia were hurting, and we know that COVID-19 has made everything in the pandemic worse. So I share the member's concerns about the impacts, and let me say more than anything, if you are someone who is thinking about suicide, someone who is suffering in isolation, if you're a family member of someone, I want to take this opportunity to reach out and let you know there are supports, especially designed through the pandemic to be safe. You can go to gov.bc.ca/COVID-19 or call 811. There are so many online and person-to-person virtual supports that are available. Foundry, there's no cost addictions counseling support. We have an expanded bounce back program, particularly focused on youth. Encouraged that this spring we launched a 24/7 mental health support line for students in post-secondary, a very strong call that came particularly from Nanaimo. But I'll say, more in a more focused way. We had started the work of building up a strong mental health and addiction system in British Columbia before the pandemic hit. We know even more now how badly that is needed. And I want to assure all members in the House of our government's deep resolve to invest more deeply in people and encourage anybody who needs help to reach out and ask for it. We need to do more, and we will do better.
Member for Surrey White Rock.
Thank you, Mr. Speaker. To me, it's clear that there is not enough mental health resources in BC. Last week, the Canadian Mental Health Association reported that 42% of British Columbians said their mental health has deteriorated since the start of the pandemic. People need more help than they are getting, and the time is of the essence to get people the support they need. My question again is to the Premier. How do people connect to the mental health supports they need today?
Minister responsible for mental health and addictions. Minister.
Thank you, Mr. Speaker. Again, I say to the member, we agree there was a great hole, as Dr. Bonnie Henry said, when our government inherited government in 2017. There was no mental health and addiction system in place. We have worked hard to pick up the slack from the front line, amazing families and service providers that had been holding the system together. But we have already, in the time that we've had before the pandemic hit, able to get more supports on the ground. We opened BC's first mental health and support team focused through the Urgent Primary Care Center in Surrey, an urgent response center. We've opened a 75-bed mental health and substance use division at Royal Columbian. That was opened in August. We've opened new Foundry centers focused on youth, a fantastic model, and we've announced the locations for 8 more. That will be a total of 19 across British Columbia. If you ask me 3 more questions, I'll be able to carry on the list of the work that we have done. And there's more being rolled out right now before, towards the end of the summer. all of the health authorities across British Columbia receive the funds to be able to expand supports for,
Thank you, Minister.
For mental health on the ground. We've got more to do and more underway.
Thank you. Member for Fraser-Nicola.
Thank you, Mr. Speaker. The pandemic is taking a toll health-wise. It's also taking a toll on the mental health of British Columbians. Seniors who are separated from their families. Parents who want to know if school exposure was in their child's classroom. Teachers who can't find out if they've been exposed for several weeks. Isolation that's impacting all of us in many negative ways. Today, we've expressed, the worries and stresses being felt by many British Columbians, and we've asked the Premier to implement a number of practical, thoughtful actions to address these concerns. So again, will the Premier embrace the feedback that we've shared today and commit to rapid testing broadly across British Columbia?
Premier.
Well, thank you, Honourable Speaker, and I thank the member for her question. I also welcome the new members for their first question period today. And I'm grateful for the line of questioning from the new Leader of the Opposition with respect to focusing on the challenge of our time, the #1 issue for British Columbians, wherever they live, whether it be on the island, in the north, in the Kootenays, in the Lower Mainland. Addressing COVID-19 and making sure that we're there for people, for businesses, and for communities. And we have been doing that for the past 9 months. I'm grateful for all the questions today, and I'm grateful to the answers, the coherent answers from ministers responsible for the particular issues that were raised by all of the members in this House. I understand that politics is now behind us, and we can all together focus on bringing forward the issues that matter to the people in our communities and matter to the people of British Columbia. With respect to the final point that the member for Fraser-Nicola made with respect to rapid testing, pilot projects are in place consistent with the response the Health Minister gave to the Leader of the Official Opposition. And we will build on that if the science takes us in that direction. With respect to race-based information and data, that is being collected. We're working with the Human Rights Commission, we're working with the federal government on those issues. With respect to the issues around mental health and addictions, again, one of the first provinces in the country to have a standalone minister to focus on these issues, establishing urgent primary care centers with mental health components attached to them, expanding acute care facilities across the province, making sure that our schools have the counselors and social workers they need for young people who are distressed at the upheaval in their lives. All of those issues raised by the official opposition today, Honourable Speaker, are valid issues, valid questions. I'm grateful that they were asked, and I want to continue to reach out and appeal to all members of this House to bring those issues forward and take the responses from the people that have been designated on the Executive Council to manage those issues going forward. We have a lot of work to do, but I'm confident this new and invigorated legislature is up to that task.
Balanced question period.